Okay, hi, it's Dr. Buford. We're just getting started on the right knee. You can see you've got some chondral loss on the medial femoral condyle. We're on the inside part of the knee here. We're using our shaver just to flush the knee because the shaver has suction attached to it. And we can also use it to smooth out some of these areas. Here's the degenerative meniscal tear here. And you can see as we open the knee up, this is where the tear has really been symptomatic, more in the back. So we'll see if we can open this up even a little bit more like that. That's starting to look a bit better now. Let me see the curved up biter. This is some of the injury to the cartilage here. Okay, now we're looking in the notch, which is the central part of the knee. This is the anterior cruciate ligament here. In just a minute, we're going to look in the lateral compartment. We're going to flex the knee up a little bit. That'll open up this compartment, as you see. And we'll go ahead and... That's good. That's plenty. And then we'll go ahead and put the shaver in, and we'll have a look here in just a minute. Okay, so we're starting to get our look in the lateral compartment here. And as expected, this posterior horn is torn. A little bit of bleeding. We're going to stop that in just a second just by flushing out the knee. But we can also confirm that you've got a lot of arthritis in this knee. And that's something we'll have to sort out in terms of helping minimize your symptoms in the office. I don't think there's much more to do in this compartment. Hit the pressure up 10, please. Up 10. So there you can see we've got some full thickness cartilage loss. And overall a knee that has a fair amount of arthritis. Pause, please. Okay. Okay, so this is basically the final little piece of information we want on this right knee today. Hold the knee so it's still pointing straight up. Roll the, yeah. And what we're looking at is the patellofemoral joint here. That's the patella at the top of the screen. That actually doesn't look too bad. As we look in the trochlea here, we can see some arthritic changes with loss of cartilage. I'm clearing out a little bit of the fat pad so we can see that a little better. And there we can see that all the way down to the front of the knee. So definitely you have some patellofemoral disease as well. Hopefully we can buy you some time, maybe in combination with some of our orthobiologic treatments like platelet-rich plasma. We can even keep you out of the operating room for a joint replacement. But you certainly have enough arthritis that may be in the future if the symptoms don't get better. We're going to keep working here, make sure there's nothing else to do. But I think this will be the end of the video on the right knee. So good luck to you now, okay? I'm going to start on the left knee next. Bye-bye. Okay, now we're looking in the medial compartment of the left knee. And arguably, well, not arguably, this left knee definitely has more arthritis in the medial compartment than the right knee. But in general, both knees are pretty advanced. You can see we're down to bone. This yellowish color is the subchondral bone. The cartilage is actually more white. You can see little patches of cartilage, but it's not a good sign when we see more yellow than white. See there? So that's an arthritic knee. That's what we call a KL4, or just a measure of how much arthritis there is. We've lost a lot of cartilage. And so because of the options and because of everything else going on, we're opting to try and do this to give you some relief, because we've tried everything else. And we still don't want to do a knee replacement, or I should say you don't want to do a knee replacement. So that's about what we can do in this medial compartment. It actually looks better than when we started. Okay, so we're just finishing up in this lateral compartment. We've tried to smooth out this meniscus and the femoral condyle, which had some loose chondral flaps, loose cartilage flaps above. So you can see that as we push in. You can see how this meniscus, although degenerative, at least it looks a little bit smoother. Hopefully less symptomatic. There's quite a bit more cartilage coverage on the tibial plateau on this side compared to the medial side. Okay, here's the patellofemoral joint, and again, fair amount of arthritis. We can track the trochlea down here. So, moderate to advanced loss of cartilage. Some areas that are full thickness. Nothing appears imminently loose here, except maybe over here, which we'll smooth that out. But otherwise, that's what we've got. So we're going to finish up here, try and polish this down a little bit more, and then we're going to get you back to the recovery room. So I hope this gives you some relief. We'll talk about maybe a PRP injection or two to see if we can extend the time that this helps you. And we'll take it from there, okay? So good luck to you now. Bye-bye.